Hi friends, I decided to create a bunch of videos on the topic of treatment of diabetes type 2 because my clients asking me. They say that they do eliminate sugars out of their life, but still they cannot get rid of blood sugar medication. So why is that? Because the diabetes type 2 is multifactorial disease, meaning that several different factors will contribute to elevated blood sugar. Unless you address your particular factor or many of those that may be cause of your diabetes type 2, unless you address that, the sugar is not going to fall. Let me give you a couple examples. One is from my previous life when I was still working in the office. About 55 years old male, thin and slim, going to gym, was in my office. He went on keto diet, meaning eliminated all sugars out of his life and still have not been able to bring the blood sugar down and get rid of metformin. So he was asking, why is that? During the conversation, the topic of the health of digestive tract came up, and I realized that was the problem. He has IBS or IBD, I don't remember, meaning he had inflammation in the digestive tract. When there is an inflammation in the digestive tract, it means that the person does not absorb all nutrients, such as vitamins and minerals, that are important in the process of utilization of sugar. So with this patient, long-term plan was treat the digestive tract, and the short-term plan incorporate vitamins and minerals that are necessary to use blood sugar in the bloodstream, for several months, and then see what's the blood sugar. The second example is very recent. One of my clients asked me to consult her mom. Mom had a diabetes type 2 for a long period of time, and she had a quite healthy lifestyle. She had a healthy digestive tract. And when I started to talk about physical exercise, so I told her that it's a good idea to start walking. Mama said that she is doing Tai Chi. And also she stated that they have a two-story house, and she always runs up and down. From the second floor, she goes to the kitchen to the first floor. From there, she goes to the laundry to the basement. So she's always moving. And by the end of the day, she's very tired. She feels that between Tai Chi once or twice per week and running down around the house is probably enough exercise. I explained to mom that it's not. So mama was, leave it. She's like, I cannot do more physical exercise. But anyway, mom and daughter turns out to be adventurous bunch. Daughter, my client, took mom on 2 weeks vacation, walking vacation, to check my theory that, to disprove that I am wrong and mama does enough exercise at home. So 2 weeks vacation, 1 week in the cities. So they decided they're going to walk. And the second week is going to be walking in the nature. I think I get the message from the daughter by the end of the first week. So here's what happened. Day one, they walk 8,000 steps. And the diet, they did not change the diet. So mama was eating whatever she was eating before. On day two, they walked 6,000 steps. And mom was measuring a blood sugar every single day in the morning. Day 3 in the morning, blood sugar is 99. Mama was elated through the whole week. And by the end of the vacation, mama had a normal sugar. So mama was sold to exercise. Mama become believer. Mama thinks that the exercise is everything. So what I'm going to do is the series of the videos on the treatment of diabetes type 2. I will go through the lectures, through the slides, and your job is look at those slides. So this is going to be a slide number 1, introduction. Okay, so I will cover all possible causes of diabetes type 2. Your job, take notes, write down. Do I do that or I don't? And if you don't, try to incorporate. So identify your own cause. It could be several causes. Okay, so the number 1 is going to be on simple and complex carbohydrates. Number 2, on the health of the digestive tract, and how it's important in regulating blood sugar. I will be talking about absorption of the sugar and importance of the liver in this process. Number 3, vitamins and minerals. Which ones are important in regulating blood sugar, and we'll talk about that. Then I will speak about herbs. I will say a few words about exercise. This is, by the way, my contact information. Okay, let's go.